Everybody ready? All right. Okay, so my name is Zelma Lopez. I'm the director of the Cavern City Child Advocacy Center. We're the group that's hosting the SWAG program this year. I'd like to introduce the rest of our group, so I'll turn it over to you, Angela.
Hi, I'm Angela Parent. I am the sexual assault and domestic violence nurse here at the Cavern City Child Advocacy Center. And we do these prevention programs and outreach and education in the community to try to educate our youth as well as the adults.
Great. Jolie?
I'm Jolie Baldwin, and I'm the forensic interviewer at the Cavern City Child Advocacy Center.
Jasmine, are you able to show? Oh, there you are.
I'm Jasmine Cobb. I'm the family advocate at the Cavern City Child Advocacy Center.
And last but not least, let's see if Maritha can show herself. We can't hear you though.
You're muted.
I'm Marita Chavez. I'm a victim advocate here at the Cavern City Advocacy Center as well.
So all of us will be having a hand in working through this program with your kids. So I just wanted you to all be able to see kind of what we look like. And now I want to get into talking about the program. So the SWAG program stands for Success with Adolescent Goals, and it's actually sponsored through a grant with the New Mexico Department of Health. They've done a lot of research to find a program that they felt was appropriate to present the topics that we're going to be talking about today. Oh, there we go. So the program that your kids are going to be going through is called Making a Difference, and I guess we'll get to that in a minute. What we're trying to do with this program is work with kids so that they can think about, I guess, all of their options before they dive into situations that could change their path. So it is an abstinence-based program, but that's not all we're going to be talking about. We're also going to be talking about if they do make a decision to take that route, how to protect themselves, why they might want to wait, looking at STDs, how substance abuse can affect our ability to make good decisions. We'll talk to them about negotiation when we're in situations and we want to kind of figure out if we can get out of a situation or what we can do to make the situation better for us. And we're going to talk about peer pressure. We've all had to go through that in our lives, and sometimes we can just need a little bit of guidance to understand what to do in those situations. So it's kind of the objectives of the SWAG program. In the program, we're going to be doing a number of things with them. We're going to be talking about their future and what kinds of things they might want to do in their near future and their long-term future. That ties right into family planning. What do they foresee that to look like for them? They may want big families, they may want no families. All families are different, right? We'll talk to them about college. And if college is not the route for them, what kinds of careers could they go into? Financial literacy will be another important component. Kids need to know how to deal with money once they do get it. There's a service learning component that we'll talk about. And we'll also talk to them a little bit about job skills. Okay, I'm going to turn this next piece over to Angela, because one of the big components of this is really talking to kids about why they should consider waiting to have sex, and STDs or STIs are a big piece of that.
For sure. So common STDs, which we do refer to them now as STIs, but this curricula says STD all throughout. Either way, it's fine. Common STDs are chlamydia, gonorrhea, syphilis, and then HIV and AIDS. So those are transmittable infections that are reported to Department of Health. So they're able to monitor those rates and changes across the state and across age groups. And so we're going to look at a little bit of the data to see kind of where we are on that spectrum. So the most recent information that I have available for chlamydia rates are 2018 and 2019 data, and this shows the breakdown by age groups. So you can see we've got some reported in the 10 to 14 age group, but it shoots up tremendously in the 15 to 19 age group, and then 20 to 24, and starts to come back down. So chlamydia is predominantly in the, the teenager, young adult ranges, with the most highest rates of infection among the 20 to 24-year-olds. So these are things that we're going to talk to them about so that they're aware of the risks if they do decide to begin sexual activities. And the statistics are there to show that it's a pretty big deal, that cases per 100,000 over there is a pretty high number for the state of New Mexico. This chart will compare chlamydia and gonorrhea cases just for the year of 2019. So the blue graph is chlamydia, and the red graph, the red bar is gonorrhea. And so you can see that in 2019, we had some higher numbers of chlamydia, and gonorrhea was kind of a lesser on the scale. But if you look at the changes in gonorrhea from the age groups, there was a big jump from the adolescents to the 20 to 24-year-olds. And even at the 25 to 29 and 30 to 34, it's kind of hanging out still pretty close to the 20 to 24-year-olds. So gonorrhea tends to kind of be more prevalent in a little bit of an older age group. It kind of hangs around longer, I guess. So these are just the gonorrhea rates of 2018 and 2019, just to compare the 2 years. You can see that 2018, we were pretty much higher in every area than 2019. So, maybe the decrease is coming. Maybe our 2020 data would be even less. Most of this does note a decrease, except for 7% in the ages of women 35 to 39. There was an increase there, but 7% is not a whole lot. So I think kind of the trend is going down. I'm interested to see what the 2020 data will show us. What I do have for syphilis is a little bit dated. I'm trying to find some more current information. This just shows the primary and secondary syphilis rates for a span of 17 years, from 2000 to 2017. And so the red line on this graph is New Mexico compared to the overall United States data. So you can see that the United States kind of has just gradually moved up and up and up, whereas New Mexico, we've kind of gone up and down, and there's been a little bit of a change there. But I really have no explanation as to why. We've all wound up in about the same place in 2017 at 9.2 and 9.5 cases per 100,000. So we're still ending up in the same place. I don't know what's going on in the middle, but this just gives the syphilis rates by age group in those same years, 2016 and 2017. You can see the purple is the 2016 and the yellow is the 2017. Again, those rates are a little bit higher in the 20 to 29 age range versus all the other age ranges. So data may not be your thing, statistics may not be your thing, but I really think it's important for people to be aware that there is an issue. A lot of times especially with certain age groups, you think it's not really a concern, or people know better, or they do better at using protection and those kind of things. But as you can see, it affects all ages, and it's something that we need to be educated about to be able to protect ourselves. So just wanted to kind of give you that information to know that those are some of the things that we will be talking about with the youth in this program. And Ariane, I don't know if you can ask questions, or if you have questions, put them in the chat, but I just wanted to see if we have any questions about the STI portion before we move on.
So I think one thing that's pretty notable is just to see that although there's a huge increase in sexually transmitted infections from ages, like 15 to 19, there are 11-year-olds that are in there. So that means that there are kids that age that are engaged in sexual activity, and those are the kids that happen to have caught a sexually transmitted disease, right? So it is important for us to educate kids even as young as 10 or 11 years old when they're first entering middle school. And that's why another reason we wanted to do this program. It's not just about worrying about our kids getting pregnant, which is definitely a lifelong decision we have to deal with, but the sexually transmitted diseases, some of those don't go away, right, Angela?
Correct. So in the chat, there's no questions.
Okay. Well, then the program's broken up into 4 pieces. We start off with an entry and exit survey. So the kids will take that tomorrow at the beginning, and then they'll take it again at the very end of the program. And what we hope to see is a little bit of difference in what they know about all the issues that we discuss. I'd like to see some growth there. The next component is the actual meetings that they're going to be going through. And so our plan is to kind of pace with the kids. We have 10 to 12 meetings that we anticipate holding. It just kind of depends on how quickly the kids want to go, how many questions the kids ask, so how soon we get done. The third component is a service learning project, which is really kind of neat. It's going to be something that we do as a group to not only learn, but also improve our community. And then the last thing that we might be doing is a parent training that we'd like to offer to you guys should we be able to. So we're going to start just kind of going through the entry survey with you guys so that you can see what the kids are going to see. They're going to do this survey by themselves. You won't be there. And some of it is a little personal, so we wanted to go ahead and show you what's being asked, but just understand that no matter what you see here, they're talking about it already. So let's see. Oh, you know what? I guess I have to, do you see it right there?
I see the link, but I don't see the actual survey popping up.
Okay, give me just a second. Because even after all of this time, we're still not perfect at this.
I have to share another screen.
Yeah, I guess I turned it off. Hold on. I turn it back on. Okay.
There we go.
All right. So the survey starts off pretty mild. Just going to go through some demographic information. I'm going to kind of run through these real quick. Let's just pretend I got some autofilled. I'm just going to ask, again, basic demographics. I don't know if your kids are familiar with race, so if you'd like to discuss that with them, that'd be great. On how they choose here, if you're Hispanic, they're going to fall in the white race. This next section kind of gets into a little more personal stuff. We're going to talk about alcohol, tobacco. I'm actually taking over for Angela. Angela, this was your section. Or do you care?
No, I don't care.
They're going to choose what best fits them. We've got lots of living situations because our kids, unfortunately, are living in lots of different living situations. Depending on what they feel is appropriate for them, they'll select that. And then we get into kind of the personal things. This is why we don't want parents with them when they're answering these questions. So some questions about drugs, cigarettes, the Juul, what are those called? Vapes, any kind of tobacco, marijuana, prescription drugs that are not their prescription, right? Just kind of checking to see what and if they're doing any of those things. Then it goes into some things about peer pressure, right? Have they felt or have they been able to resist peer pressure? Do they feel like they're able to manage their emotions, which is really important, self-regulation? Do they think about what will happen when they make decisions? And then this one, have they talked with their parent or guardian about sex in the last 3 months? Probably most haven't. There's some questions about their goals, right? Do they make plans about goals? Do they care about school? Do they think about saving money? Lots of kids don't, right? They get it and they got to spend it. Would they be willing to ask for help if they were being bullied? That's a huge issue for kids in our community. And would they speak up if someone else is getting bullied? Then we're talking about relationships and dating here. Do they understand what makes a healthy relationship? I know that they're in homes that have relationships, right? This is just kind of, do they understand what makes one healthy? Would they be able to say no if someone pressured them into participating in kissing, private touch, or touching on private parts or sexual activity? And would they feel comfortable talking to someone other than probably a friend, right? Talking to an adult if they did need some kind of help. So on the entry survey, well, I should have answered those. That's kind of all they have going on. So we're going to talk about each of those things during our class. And hopefully when we come out of it, they'll be able to say that, yes, they do understand what healthy relationships are. They will have the skills to be able to say they're not interested in doing things they don't want to do. They'll know how to deal with peer pressure. They'll be more educated about how drugs and alcohol will affect them, their decision-making, and they'll understand reasons that they might want to postpone sexual activity. Do we need to go through the exit survey, Angela? I don't remember if we did that before.
It's the exact same survey. So it's just at the end so that we can see maybe if their answers have changed, if they've grown, if they've learned different coping mechanisms, or how they have talked to their parents more during this program than they had prior to, those kind of things.
So nothing crazy shocking about the survey, but do you have any questions about the survey? The really cool thing about the survey is that survey is taken by kids all over New Mexico, and then that data is compiled by the Department of Health so that they can kind of get a better gauge on what kids are doing in New Mexico right now. So we appreciate your kids participating in that, as well as giving us an idea of what the kids in our class are thinking about and doing. All right, so the Making a Difference curriculum, Jasmine.
Okay, so I'm just going to be talking about what we're going to be teaching your kiddos while they spend time with us. So we have 8 modules that we're going to be doing with them. So the first one is, of course, getting to know you and making your dreams come true. So this is kind of all about, success with their goals and things like that. So part of this module is to use a goals and dreams timeline. And so that's really important for them, just because if you put it on paper, they're able to kind of brainstorm a little bit and figure out what their goals are, because there's still a lot of them are pretty young. So number 2, understanding adolescent sexuality and abstinence. A lot of them are, once again, pretty young. So some of the things we're teaching them may be the first time that they've heard them. So, just teaching them what all of these things are, the consequences of sex and HIV, attitudes, beliefs, and giving advice about HIV, STDs, STIs, and abstinence. So really with attitudes, this is gonna help establish positive attitudes towards, the thought of abstinence, and also just that, the HIV, STIs, all of those things are real. So just establishing that it's okay to learn about them and learn about how to prevent them. So the consequences of sex. So we're going to talk about STDs, STIs. Sorry, it's weird that it says that and it's not that. Okay. So the consequences of sex. So we're going to talk about, of course, the consequences of unprotected sex or even having sex is pregnancy. We're going to talk about responding to peer pressure and partner pressure. So a lot of the kids are in middle school, maybe some thinking about moving on to high school. So peer pressure and partner pressure as they get into relationships is a big part of learning and growing and, kind of finding your voice whenever it comes to peer pressure. So we're going to teach them about peer pressure, and then the refusal and negotiation skills. So we're going to teach them that it's okay to say no, and different ways that you can say no, even if you don't want to be, rude or things like that.
Jolie, you're going to tell us about this section.
All right. So the My Life, My Plan is just an additional lesson that we have that kind of supplements what they've already learned in the Making a Difference. And it allows them to really think about what's going on in their life right now and plan for their future. So they get to have the booklet and fill it out and kind of make their own plan. It covers 6 topics: health, mental health, relationships, reproductive health, family health history, and their future. We will also be having, since we're doing it at the college, we have the career counselors at the college. We'll have them come talk to them about career planning and planning for college and things like that. And we'll have other guest speakers. We'll have someone to come in and talk about reproductive health and the different contraceptives that are out there. We'll have someone from the bank come talk about financial planning and things like that.
So we're just giving lots of opportunity to ask questions. I do want to say one thing. Thank you so much for saying, asking about the times. I forgot. Because we're doing the sessions this year a little bit differently, and we're going to have the kids for a much longer period of time. So they're going to join us at 9 o'clock in the morning and then not leave till about 12:45. So we actually are almost doing 2 classes in one. So you are correct. It will be far less than 12 sessions. I apologize. We would be looking at completing the 8 modules in about 4 days. And then of course, we've got all of the other little pieces like the My Life, My Plan, having the guest speakers come in. So it will be closer to 7 sessions. So thank you so much for asking about that. Okay. So the curriculum, again, it's tried and true. It's tested. It's evidence-based. Everything that's being taught is grounded in really good research. So I feel like you can feel very comfortable with your child going through these classes. All right, now there is a service learning component to the program as well. And so I just want to kind of define for you the difference between service learning and community service. We actually were joking about this today because it would be so nice to just like gather the kids all up on a Saturday and like clean the side of the highway and we're done right away. And you do feel good about doing things like that. You know, you're cleaning up your neighborhood, you know, you get to spend some time with friends and engage in a lot of great discussions during that, but that's not service learning, right? So what we want to do with the kids in this program is service learning. So there'll be an educational component so that the kids are learning something and then taking what they've learned and put it into action. Because it's summer, and we do have such a short period of time that we're going to be with the kids, we actually have a thought of what we'd like to do with them for this year's service learning project. If the kids hate it, we'll talk about something else, but what we'd really like to do is spend some time talking with them about the issue of human trafficking, and especially how it relates to young people and how it relates to our particular community and things that are happening in our community. So what we'd like to do is spend the 6 sessions that we have with them learning about the program that we have, and then just kind of throwing in there what we know about human trafficking and what we know about their safety. So at the end of that, what we're hoping is our kids will be able to come out with some PSAs that we'll be able to play on the radio or at least publish on our website and on Facebook, so that we have youth talking to other youth, explaining to them why they need to be aware of human trafficking and what to do to not fall victim to that type of crime. So when they're doing the service learning, again, there's an academic component. Students are engaged in that, they're learning, they get to work together, so there's that social behavior, and what they pass on to the community could change our behavior socially in a big way. There's definitely civic skills component when they get to put that together and present. And as far as strengthening community partnerships, I'll tell you, one of our really great partners is the New Mexico Attorney General's office, and I'm sure they'll want to come back again this year and speak with the kids, because they truly feel the kids are the future, right? If we can get them to learn what to look out for and how to make good decisions, they'll be less likely to become victims of that type of a crime. So that's what we're kind of thinking for the service learning component this year. We wanted to show you a little video just to kind of explain why we think it's so important to talk about human trafficking. Please let me turn the sound on. Here goes. Oh, back.
As the infection rates of the coronavirus are rapidly increasing across
How are we going to afford this?
Health officials are continuing to stress the importance of social distancing in an attempt to flatten the curve.
So just a little video to kind of give you a hint as to what could be happening with our kids. We just ended 2 years of kids being isolated for the most part, not being around face to face with a lot of folks, but their phones were always available to them. And their phones are one of the major ways that not only people who are just trying to do them harm might get a hold of them, but it's also a tool used by human traffickers. And what was happening to this young lady here could very well be a form of human trafficking. Kids don't actually have to even leave their home to be trafficked. People can find ways to make money off of and use your children without them ever leaving their home. And so making kids aware of that fact, and parents too, is so important. No, no one else is in the waiting room right now. I wanted to share this little piece of information from you. I just got this off of the NCMEC site, which stands for, somebody help me, oh, actually, National Center for Missing Exploited Children. It's a really great site. It's actually, they actually sponsor a lot of teen sites. So they have a link on the bottom of a lot of those resources that kids are on to report any type of cyber crimes that they come across. But this is interesting. They said in 2021, they received 29.3 million reports of suspected child exploitation. So that's something that they're seeing or seeing visually through a picture or through text message, but all cyber, where someone's trying to do something inappropriate sexually with a child. And that's up 35% from 2020 when COVID first started. We don't need to get into all these types of crimes here, but what I would like to show you is down here at the bottom. In 2019, so pre-pandemic, there were 16, almost 17 million reports that were made to the National Center for Missing Exploited Children. That jumped up to almost 22 million in 2020. And now in 2021, we're almost at 30 million reports. I don't think it's because people are just more aware, so they're making more reports. I actually think it's because there's more child exploitation happening now that kids are on their phones so much, and it's younger and younger kids that are on phones and tablets and computers that weren't on those before. So when you have online predators, something like COVID was really a great deal for you, because now you have so many more kids that are vulnerable and may not understand what's happening when they get on there to ask how they're doing. Do they need someone to talk to? They're beautiful, right? All of those things that we saw in that short video could be happening to children as young as what, 5 or 6, because they're on phones and computers, not only for school, but we got comfortable with the school thing, right? And we just kind of let that go into summer, and we're all on electronic devices far more than we need to be. So this is one of the reasons, again, that we think a human trafficking topic would be so great for our kids right now. Even in our staff, you guys have any thoughts about that? Try to hit you hard. If you didn't see the little video that the kids did last year, that presentation they put together was really great because it was all student-led. They looked all that information up on their own, and I think those kids are really aware. We had parents actually call and talk to us afterwards and say, my kid learned so much, you know, even the idea of just being able to talk to them a little easier about the other topics that they're going to learn. It's funny because in our job, we get to talk to kids about all kinds of things, right? And one of those things often is inappropriate sexual activity, or just people making them uncomfortable. And a lot of times we're the only people that ever want to talk to them about that. Parents often shy away, teachers sometimes shy away. So I think a platform like this is really great because we're going to want to hear whatever they have to say. And I think that's good for them to know that there are adults out there that are willing to. All right, Angela, you want to tell them about this at all? What you do know about it?
So this is a program that we may or may not be doing this round. The parent training is called From Playground to Prom, and it just is there to help you feel more comfortable talking to your children about sex. It gives you kind of tips and ways of opening up those conversations, and how to have those in a positive way so that kids are more comfortable talking to you. I don't remember if we went over it at the beginning of this, but I think Zelma did say that, you know, the one thing that these lessons have learned and what they've pulled from has been that kids are more comfortable actually talking to their parents about things like this than they are other people. And so sometimes as adults and as parents, we just kind of have to get over that. This makes everybody feel awkward, you know, kind of feeling, and have honest conversations with our kids so that they know that if they find themselves in a situation or they don't know what to do about something, that they're able to come to us and be able to talk to us about those things. And so this may be towards the end of our swag sessions here, but it may be something that we actually are waiting on to the next round. So we'll just kind of have to see how that plays out.
Yeah, and so even if we don't do that now, anytime we do offer it, we can put that on our Facebook page, and any parents that would like to attend are more than welcome to. So important that our kids feel comfortable talking to us, because if they don't talk to us, they're going to talk to somebody, and we don't want it to be the creepy guy on the phone for sure.
Or the teenager that doesn't have their information correct either. So now we're all uneducated.
Yeah, most definitely. So I guess that's all for our slides, which brings me to any questions? And I do appreciate you being here, because I know a lot of the other parents couldn't come, but we will have them watch this. And so when you're watching this, if you do come up with some questions, you have all of our email addresses in the email that you received. Another way to get a hold of us is to go to our website, which is www.senmcac.com. We have a staff page and all of our email addresses are there. You just have to click on it to get to us. So tomorrow, we don't know the room. We will by the time your kids get there. So I'll be sure and make sure that there's a sign outside of the door. What you will want to do is drive around to the back side of the college. And I don't know, the way I always think of it is that's where that auditorium is. So that is where I've been told that we're going to be. So I don't know if we're upstairs or downstairs in that building, but there'll be a sign out there for you. The kids will get their lunch, 11:45 to 12. It'll kind of be a working lunch. We'll eat and talk at the same time. And they are going to come home with those booklets that we showed you. For sure, the Making a Difference. I don't know if they'll bring the My Life, My Plan home tomorrow or not, but there is a little bit of homework. Angela, do you recall? Not a whole lot, right?
No, it's not a lot. And given the timeframes that we have them this time around, since we have them for longer, you know, they may be able to finish that while they're there. But also with regard to what room they'll be in, we have staff that one of us can be up there to kind of direct people as well.
Yeah. One of the things on the flyer that I hope your kids saw is we do want them to learn all of this, but one of the great things that the Department of Health thought of was we should give them an incentive to come, because I know it's summer, and even if it was during the school year, it's like another class that they have to attend. So they are going to receive a $100 gift card for participating. I think that's really great, and they're deserving. I think to take the time and talk about this stuff is really important, but also kind of difficult. So we appreciate them doing that. Another thing that we like to do at the very end, so we'll let you know, is we do want to hold sort of a family dinner, I guess, to appreciate them for everything that they've learned. Maybe they'll have something they can present for us, like their PSAs, maybe some things that they've learned that they'd like to let you all know about. We'll have some food together, and we'll kind of wrap it up on a high note so that the kids can enjoy their summer safer and more educated about these very important issues.